You stub your toe in the kitchen at midnight, completely alone. You wince, sit down, and reach straight for the pill bottle. One small tablet, and within minutes the pain fades quietly in private. You don't call anyone. You don't want to bother them. That's the whole ritual now. A pill, a glass of water, silence. Nobody watches you wince. Nobody hears you gasp. Nobody says a word. Now take all of that away. For 99% of human history, pain didn't happen behind closed doors. It happened at the fire, in the open, in front of everyone. Childbirth witnessed by the whole camp. Injury tended in full view of everyone. Deliberate ritual wounds made in front of the entire group. No morphine, no ibuprofen, no anesthesia of any kind. So how did they endure agony with absolutely nothing to numb it? Let's start with something strange doctors noticed on a beach in 1944. In 1956, physician Henry Beecher published data from the Anzio beachhead in Italy. He was treating soldiers wounded during heavy fighting. Many had injuries severe enough to end a normal life for months. Yet when Beecher offered morphine, most soldiers turned it down. Published in the Journal of the American Medical Association, his numbers stunned colleagues. Only about 1 in 4 wounded soldiers wanted strong pain relief. For context, that's a massive gap for identical physical injuries. Beecher then studied civilians recovering from similar surgical wounds back home. Nearly 4 in 5 of them asked for morphine almost immediately. Same tissue damage, same nerve signals, wildly different pain. But here's what's fascinating. For the soldier, the wound meant something specific, survival and a ticket home. For the civilian, the same wound meant disaster, disrupting an entire life. So pain is just in your head then? Not exactly. The tissue damage was completely real in both cases. What changed was the meaning the brain attached to it. Meaning, it turned out, was a painkiller nobody had named yet. Athletes report the same strange effect today. A broken finger mid-game can barely register until the final whistle blows. The injury doesn't change. What the moment demands of you does. In 1965, Ronald, Melzack, and Patrick Wall at McGill University proposed something radical. They called it the gate control theory of pain. Pain signals travel up the spinal cord, but they hit a gate before reaching the brain. That gate can open wide or slam almost shut. Attention, emotion, and expectation all hold a hand on that gate. Distraction can close it. Fear can throw it wide open. That's why rubbing a stubbed toe actually helps. You're literally flooding the gate with a competing signal. Expectation turned out to be an even stranger key to that same gate. Neuroscientist Fabrizio Benedetti at the University of Turin tested this directly. He gave patients a completely inactive sham treatment for pain. Simply believing it was real medicine triggered the brain to release its own natural opioids. The relief was measurable, physical, and completely real. And here's the part almost nobody talks about. Touch alone another person's hand can help close that same gate, which raises an uncomfortable question about pain today. Picture a hospital room right now. White walls, a beeping monitor, an empty chair. That's not a coincidence. That's the exact opposite of a closed gate. If presence closes the gate, what happens when you're in pain completely alone? In 2013, a review in the Cochrane Database looked at over 15,000 births. Women with a continuous companion during labor needed significantly less pain medication. Not a different drug, just a hand to hold, and a familiar voice in the room. The gate wasn't chemical that time, it was relational. In 2015, researcher Bronwyn Tarr at the University of Oxford ran an experiment in Brazil. One group of dancers moved in sync with each other. Another group danced the exact same steps but completely alone. Published in biology letters, the synced dancers showed something remarkable. Their pain threshold rose. They tolerated significantly more discomfort. Their bodies had released a flood of natural opioids just from moving together. Anthropologist Robin Dunbar had predicted exactly this for years. He called it social bonding through endogenous endorphins. For most of human history, that mechanism ran constantly. Drumming before a hunt, dancing around a fire, chanting through labor. In 2011, researchers led by Ivana Konvalinka and Dimitris Sigalatas studied a fire-walking ritual in San Pedro Manrique, Spain. Published in the Proceedings of the National Academy of Sciences, they measured heart rates across the entire crowd, not just the walkers crossing the hot coals, everyone watching too. The heartbeats of walkers and their close relatives synchronized almost perfectly. Strangers in the crowd showed no such pattern at all. Shared meaning, it turned out, could sync bodies from a distance. In the Amazon, some Satere-Mawe communities still hold a ritual using biting ants. Young men endure the sting for minutes, surrounded by the entire village chanting. Elders press herbs to the skin, and hands stay on the initiate's shoulders the whole time. The pain isn't hidden away, it's the center of the ceremony. And here's the part that should really land. The community wasn't just watching pain, they were closing the gate together. Every drumbeat, every synchronized step was flooding that same spinal gate. Not with a pill, with other bodies moving in rhythm. So is a drug really the same thing as a hug? Not quite. A pill closes the gate chemically from the outside alone. A crowd closes it biologically, the way evolution built it together. Today you have the most powerful painkillers in human history, and you're more likely to take them completely by yourself. No drumbeat, no hand to hold, no chanting crowd, just a small bottle and a quiet room. Ancient humans didn't feel less pain than you. They simply had more hands nearby when it happened. Not less suffering, less solitude. We didn't just invent better drugs. We quietly removed the crowd that used to help the drugs work. Somewhere between the fire and the medicine cabinet, something got lost. Not the chemistry, the company. We started hurting alone.